Welcome, everyone. We are just waiting one more minute and we'll start for one more speaker. Um, just so that everyone knows, we have interpretation. Thank you, Sarah. Can the other interpreters please press record? And Peruth, maybe over to you for language justice, and then we'll begin.
Thank you very much. I think I'm supposed to add Christy to the language interpretation. She must be here already. Christy, you just let me know if you're here so that I can add you for language interpretation. And Marie, can I first add Christy to this?
Ruth, it's hard to hear you.
Yeah, I'm just wondering, can I add Christy to the language interpretation channel?
Yeah,
I think she's here.
Certainly. Let me make you host and I'll let you do it since the last time.
And Marie, you can do it as I give an update on language interpretation.
Perfect.
Just to save time. Thank you very much. Hi everyone. It's good to see you today. Thank you for joining us for the session today. We just giving updates for language interpretation. We have Haitian Creole under Christy. We have Spanish under Grace. We have Arabic and Sarah, and we have Portuguese under Alex. So
Português, Alexandra.
Oh, sorry. This is what happens. Sorry, Peruth. I'll make you host to reset the panelists.
Okay.
I guess we are outside the booth.
Yes, we are. We are outside.
And I'm not sure if I'm the one who you are trying to add because I've been in the channel since the beginning. I received a Zoom link for interpretation.
Yes, but we are
out. I am in the channel.
Okay, Chris outlined. Thank you. Okay. Oh, great. Let me add you on.
Hi, everyone. Thank you for joining. We'll just be 1 minute. We're fixing interpretation and then we'll get started.
Then we can start. So I'm checking in with all interpreters just to confirm that they're in the right channels, and then we can start. Just a minute. Yes, Sarah, are you there? Can you hear me? Good. Good. Thank you. And Grace, can you hear me? Great. And Alex, can you hear me?
May we make Dr. Mustafa Al-Qawasmi panelist?
Chris, can you hear me? Great, thank you very much.
Yeah, Dr. Kifah, I can do that now. Peruth will make me the host after we have interpretation.
Now. Can you hear me now? Can you hear me now? Okay, great. Done. So, Anne-Marie, we are done with the setting up language interpretation. I guess I can just give an update. I encourage people to check for language interpretation. Please check the globe icon, and then find the language that is good for you to understand well. And we encourage those who intend to speak slow to enable language interpretation so that everyone can be able to follow. And yeah, I think that's it at the moment in time. For any challenges, please don't hesitate to reach out to the language interpretation support in the chat, and then we can be able to fix everything. Thank you very much. Over to you, Anne-Marie.
Great. If you can just make me host, I'll allow Dr. Mustafa to be a panelist, and then we'll begin.
You're a host now, Anne-Marie. Thank you.
Amazing. Okay, Kifah, we can start. It's not allowing me to assign Dr. Mustafa as a panelist, so we can work behind the scenes on that if you want to start.
Hello, did you hear me? Dr. Mustafa speaking.
Yeah,
Yes,
we hear
doctor,
you.
we hear you.
Perfect.
Okay, so I will speak in Arabic or in English. I don't know what would you want. So
We have interpretation, so as you wish, Dr. Mustafa, please.
okay, so I will try now. I will speak in Arabic, okay, because it's more comfortable for me to speak in Arabic more than in English. Okay, so I will speak slowly, okay, for translation, okay?
Yeah, Anne-Marie, just to chip in, if we are to speak in Arabic, then other channels have to connect to the Arabic channel. We thought maybe we'd speak from English so that we can be able to interpret for other audiences.
Okay. So يسعد مساكو، مساء الخير للجميع.
لسه دكتور لسه ما بلشنا، لسه كمان شوي. احنا لسه
Okay.
رح نعرض presentation وبعدين حضرتك.
Okay.
But Ruth, Dr. Mustafa will speak in Arabic. Nebal, did you check? Nebal, did you said you will speak in Arabic or in English?
I'll speak in English.
Okay, Nebal in English, Dr. Mustafa in Arabic, and we have the videos in Arabic.
Okay, so maybe when we are going to do Arabic, if we are going to speak Arabic, please just let me know so that I can change interpreters to all connect to the Arabic English channel.
Ruth, you got the agenda, right?
Yeah.
Yeah. So, Doctor, I'll tell you right now, Dr. Mustafa and the videos are in Arabic. Me and Nebal in English. And also Fahid, I guess, and Tina, she were in English.
Okay, fine.
Okay. Should we begin right now or we are waiting for other people? Don't know.
We can begin. Thank you,
We
Dr.
can.
Kifah.
Okay. Let's check again if I'm right now making it. Okay. Now you see the slides. May we begin?
We see everything perfectly. Thank you.
Okay, good. Well, today our press conference regarding the genocide in Palestine and how we could make some efforts to stop it. We were doing this by PIFA, Doctors Against Genocide, and also Equal Health. Right now, I'll give you like a background or briefing about what's happening in Palestine. The crimes in Gaza and the West Bank amount to genocide, and was abducted from international community, so with severe long-lasting consequences for the Palestinian population. The international community must urgently intervene to stop the genocide and to prevent further destruction of life. This briefing will focus on the devastating impact on the genocide, on food security, healthcare, education, and the basic human rights in Palestine. The Gaza, for the food security in Gaza, now I'll go to mention all the aspects. In Gaza, 91% of Gazan population faces acute food insecurity. 867,000 people in emergency, IPC phase 4 levels, 344,000 people in catastrophic levels. Agriculture sector, because it was like all of it distracted, all of it damaged, 68% of the cropland damaged, 52% of agriculture wells destroyed. Is that okay for the interpretation? 44% for greenhouse destroyed, 70% of the fishing fleet destroyed. The livestock crisis, 95% of cattle lost, 43% of sheep, and 37% of the goats still alive. Only 1% of poultry survived. This makes it difficult for the Palestinians to survive. The nutritional crisis, 96% of the children and women fail to meet basic nutritional needs. 290,000 children and 150,000 pregnant breastfeeding women need nutrition urgently. 60,000 children will need acute malnutrition treatment in 2025. For the water supply, we have like 87,358 cubic meter of water produced daily, less than a quarter of pre-conflict levels, pre-genocide. 62% of Gaza's population, almost 1.4 million, receives less than 6 liters per person per day. Even that, it's like you have to get 15 liters per day, usually, at least. The sanitation threats, 1 million people are at risk from sanitation-related issues, rodents, pests, and waste. Rodents and pests, 76%, solid waste, 54%, sewage, 46%, human waste, 34%. We have a collapsing of the healthcare infrastructure. 17 out of the 36 hospitals are partially functioning and remaining fully collapsed. 11 field hospitals operational. They were done by the help of some countries. 37% of primary healthcare centers are functional. 130 ambulances destroyed. The middle evacuation bottleneck, because now we have critical injuries, critical patients in Gaza, they don't receive the medicines. So 39% of the critical patients are approved for evacuation, but not all of them get evacuated to get the therapy. 14,000 patients still need urgent medical evacuation. And now the World Health Organization is trying to help with that. The humanitarian worker under attacks, 343 aid workers killed, including 253 UN staff. We have these statistics were adopted before 2 days. Till 2 days, it was like now we have more people, but 1,074 health workers killed, 88 civil defense workers killed on duty. The education system ruined 658 students lost access to formal education, 11,714 students and 463 educational staff were killed. 87% of the schools need complete reconstruction, and the remaining are used as places for shelter for the people. The massive housing destruction, 87% of housing units destroyed or severely damaged, and 1.875 million people need emergency shelter and essential household items. Overcrowded shelters, because we have in 1.5 meters square per person in shelters below the emergency standards. We have 950,000 people need winterization support right now. The commercial and infrastructure damage, 80% of the commercial facilities damaged and 68% of the road network destroyed. And that makes it very difficult for the people to be evacuated, even the injuries. Casualties since the October 7th in the West Bank, 797 Palestinian killed, including 168 children were killed, and we have a lot of insults and attacks from the settler violence in the West Bank. Over 6,450 injured. Healthcare under attack. Over 600 attacks on healthcare facilities and personnel in the West Bank, where there is no war or genocide or whatever. It's only attacks from the Israeli occupation military forces or from the settlers. And the movement restrictions hinder access to care. We have also severe movement restrictions, blocked access to medical care, food, and emergency aid worsens condition, widespread displacement, and heightened risks of disease and death. The displacement are mostly the vulnerable communities where are based in Area C. Now we have a lot of communities were displaced, more than 25 community in the Area C in West Bank and in the Jordan Valley areas, and also in Hebron and Masafer Yatta. We have the prisoners and detainees. Their situation is so difficult right now because we have 47 detainees died in the Israeli prisons since October 7th. And 29 Gaza detainees have died under unclear conditions because there is no any information about the Gazans detainees. The detainees numbers are 10,300 detainees, including 100 children and 27 women in a Damun prison. And today there was like a report about their worst situation and what the difficulties that they are facing, especially women and children. The problem that we are having also that we don't know the numbers of the Gazan people because they are using enforced disappearance for them. And we only know that they have a lot of a presence like Teddy Sedman and others that they capture the Palestinians and arrest them from Gaza, and they put them and they don't give any information about them for their families or the Red Cross or the lawyers. So we don't know anything about them, except some reports say that they are more than 10,000 at least. Children and women are subjected to harsh conditions. What we are asking for what we are asking is protect Gazan children, provide nutritional support and mental health care, rebuild healthcare infrastructure, urgently restore hospitals and healthcare centers, ensure humanitarian aid, lift movement restriction to allow the flow of aid, address the detainees crisis, immediate release of political prisoners. The other issue that I wanted to mention that they are targeting the UNRWA right now, and they are closing its offices, and they consider the UNRWA the United Nations for the refugees. They consider it as a terrorist organization, and they closed its offices in Jerusalem, and that makes the situation for the people who are living in the camps, even in Jerusalem, Shafat camp, Kalandia camp, and also in the West Bank, their situation is worsened. So this is a problem that we are facing. I just wanted to add this. The conclusion, the ongoing genocide in Gaza and West Bank requires urgent and decisive international intervention. The international community must act now to end the violence and provide basic humanitarian needs. Join us in demanding immediate international intervention to end the violence, provide humanitarian relief, and protect human rights. This is what we tried to make it as a background for the press conference today from Palestine International Friends Alliance. We ask you how you could help stand with Palestine, raise awareness, advocate for justice, and amplify Palestinian voices, volunteer with humanitarian organizations. Thank you. This was our presentation about just to tell you what's happening here in Palestine. Right now, we will continue with our program. We will take Dr. Mustafa Al-Qawasmi. He's Director General of Emergency Unit, Emergency Directorate in the Ministry of Health.
Okay, thank you, Kifah.
You're welcome, Doctor. تفضل.
Can I speak? Okay. I speak in Arabic, okay. If you want to translate. So يعني كفاح أول شيء شكرا كتير لك على هاي المقدمة الممتازة. I don't hear the translation يعني so I don't know if it translates.
Dr. Mustafa, hi. We have simultaneous interpretation, so please go ahead and speak in Arabic. Thank you so much. And no need to pause. It's simultaneous.
Oh, no need to pause. Okay. Okay. So كفاح شكرا لك على هذه المقدمة اللي عرضت فيها الواقع الذي يحدث الآن في قطاع غزة أثناء الحرب الإسرائيلية الشنيعة وارتكاب الإبادة الجماعية ضد شعبنا الفلسطيني في قطاع غزة، وأيضا الحرب الصامتة التي تدور في الضفة الغربية من قبل جيش الاحتلال والمستوطنين ضد المواطنين الفلسطينيين. الأرقام اللي عرضتيها هي أرقام ذات مصداقية عالية، هي أرقام التي تخرج من وزارة الصحة الفلسطينية، وأيضا وتعارف عليها ومصدقة من قبل منظمة الصحة العالمية ومؤسسة الأوتشا الدولية. فهي أرقام حقيقية، أرقام تعكس صورة الألم الذي يحدث ضمن المنظومة الفلسطينية. راح أحكي عن القطاع الصحي الفلسطيني اللي أنت ذكرتي مجموعة كبيرة من معطياته بما يخص عملية الدمار اللي أصابت المستشفيات الفلسطينية في قطاع غزة وحرمان المواطن الفلسطيني من الخدمات الطبية والإسعافية، وعملية التدمير الممنهجة ضد المستشفيات، وكل أنواع الاختراق للقانون الدولي فيما يخص الحماية الدولية حول المؤسسات الصحية. إن ما حدث في غزة من تدمير شامل
sector, what happens in Gaza, the full destruction of the sector, the health sector, and attacking the hospitals and the health sector is the first, is with no precedent in history. Destructing 130 ambulances reflects how they are targeting these ambulances. Those ambulances are actually are owned by the Red Crescent, Palestinian Red Crescent, which are protected by the international law, but Israel did not respect the international law, and they did not respect the ambulances, and they attack them directly and target them. And that's why a number of the workers have been killed. 54 of them has been killed during in Gaza from those providing health care, and some of them are detained. And you know what happened in Al-Shifa hospital, Kamal Adwan complex, and the Indonesian hospital, and it has been transmitted directly on TV, and this shows the viciousness of the Israelis, and they are and their insistence on preventing healthcare to be provided to all Palestinian people. And when a person is when they are prevented of these health care services, and when the ambulances and the workers in the health sector cannot provide those services, and when you target those workers trying to provide those services and preventing all type of assistance, healthcare assistance, and whatever happened in the northern part of Gaza, and the destruction that has been targeting the healthcare services, this is all actually making part of genocide. This is genocide. If you know, in Gaza now, we have a number of ill people, sick people, and terminally sick and injured who cannot have access to health care, and even the children cannot have access to vaccines. And Palestine was the first country that have been clean of many illnesses, but now, because of the vicious attacks of the Israelis, they don't have many illnesses have been spread, and we are living in very difficult health situation. The situation in the West Bank is not better than what's going on in Gaza. In the West Bank, they have 700 barracks, or they are barricades, and they are actually isolated from each other. And the Ministry of Health, the Palestinian Ministry of Health, cannot provide the services, and it's really very difficult to provide health care in a number of places. And that's why we go through the international institutions and try to use vehicles to provide those healthcare services to Palestinians. And the restriction, the movement restriction as well, has banned and restricted the movement of the health workers. They cannot move through those barricades, and because of the violations, the continuous violations against those workers, and sometimes they are insulted, sometimes they are attacked directly with they are being fired at, and that's how they are prevented from providing healthcare to the Palestinians. Even sometimes when they go out and try to evacuate a sick person or an injured person to the hospital, we we are actually they are attacked by the Israeli who close down the hospitals, who prevent them from going into the healthcare units. And there's as well the Israeli are continuously trying to attack the health workers who are working inside the hospitals and who are working in the healthcare units through detaining those health workers and attaining them, just like what happened 2 days ago in Silwad and in Tulkarem Hospital and in the Arab hospital. The violations, the Israeli violations against the international law and attacking the healthcare sector and the ambulances, it's continuous. It did not stop. And Israel is violating all the international laws protecting the health sector. In addition to this, this is affecting the provision of healthcare to the population because the Ministry of Health and all its partners are incapable of putting a plan, a clear plan to respond of response because nothing is respected. No plans are respected, and they are not they are not respecting the international law. They are not respecting the protecting. They are violating the protection provided for the health sector by the international law, and just like the schools and 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 we are trying actually to work in these difficult conditions, but we are not able to plan because no plans are respected. We don't have the capability to implement those plans, and the Israelis are preventing the provision of healthcare services through the barricades and through the attacks. What we are asking for as a healthcare sector, that we continue to provide us with help and to stand up for us against the violations and against the silent war in the West Bank and against the genocide, which is going against life and every living thing, and even the non-living things. And we need we call upon the international community to try to protect us. We call upon all of the international institutions and the Arab institutions and the regional institutions to provide us with help, especially in Gaza, whether it's medical, health assistance, mental assistance. Everything is very scarce and we cannot have access to food. Even a grain is difficult to find. It's and this is affecting the provision of services in the health sector, in the hospitals, and even the clean water. We don't have access to clean water in Gaza. The health security is not found in Gaza. The food security is not found in Gaza. Everything is not found in Gaza. We wish that the whole world will stand up for us, will stand with us, will provide us with help against this genocide, and they will open the doors to provide us with help, with assistance, and try to rebuild what have been destructed. And one of our priorities is the healthcare sector. I'm sorry for being long. Thank you very much, Dr. Mustafa. And we wish that in the coming opportunities that we will just abide by the time. Thank you, Dr. Mustafa.
Participation, and we should mention that we are gratitude thanking the Ministry of Health because they help us with the videos that we will podcast right now. I'll ask Annie, please share with us, Dr. The testimony of Dr. Hussam Abu Safieh, the director of Kamal Adwan Medical Complex. and they are suffering a lot right now. Annie, please.
بسم الله الرحمن الرحيم. أنا الدكتور حسام أبو صفية مدير مجمع كمال عدوان الطبي
I'm Dr.
الذي يقع
Hussam
تحت
Abu
الحصار
Safiya
في
from
شمال قطاع غزة.
the
طبعا
Kamal
أكثر من
Adwan
60
Medical
يوم ونحن
Complex,
نتعرض
which is sieged in
يعني
Gaza.
لاغتصاب مطلق
We are
واعتصار دائم
attacked
على المنظومة
in
الصحية.
we are attacked and we are sieged completely.
Full screen it. Annie again.
Yeah, you could not hear the sound. Sorry, Dr. Kifah.
No, we can hear the sound, but we can't see the video.
Okay.
Maybe you try to share it again, please.
Certainly.
Yeah, it's working. So can you begin it again?
وطبقناها في هذه الأيام العصيبة الذي لا يمكن
دكتور
للعقل البشري أن
كمال
يتخيل ما
عدوان
يحدث في
وقمنا
شمال قطاع غزة.
لا
وعندما
يمكنكم
نتحدث عن حرب
you
إبادة
can't
فهي إبادة ليس للمواطنين
think
فحسب
about what's
وإنما
happening
إبادة
in
للمنظومة
Gaza, in
الصحية
North
أيضا.
Gaza. When we talk
طبعا
about genocide, it's not only about
يمنع كل
people, but
شيء عن
it's
كمال
about
عدوان.
the
كل
total
شيء يمنع.
destruction of the healthcare.
يمنع
Everything
مركبات
is
الإسعاف، يمنع من الدخول إلى شمال قطاع
prohibited.
غزة بعد تدمير كافة مركبات
The
الإسعاف المتواجدة
ambulances
في
don't
شمال
have
قطاع غزة.
access
يمنع من إدخال
to the
المستهلكات
northern of
الطبية بعد
Gaza.
استنفاذ
We
كل
cannot
المخزون بسبب الإصابات
enter
التي تتوهج مستشفيات
the
مستشفى كمال
the
عدوان.
medical
يمنع
resources because
من إدخال الطعام
and they
الذي
prevent us
بدأنا
from
نسجل
entering
حالات سوء
food,
تغذية
and now
ومجاعة عند
we are
الأطفال وعند
starting
الكبار.
to
يمنع
register
إدخال الوقود إلا
malnutrition
بكميات
between
محدودة
children and the
مدروسة
elders.
معلومة
They are
من منظمة
limiting
الصحة
the
العالمية متى
entry of
تأتي ومتى
fuel,
تنتهي، ونعمل
and
بترشيد حتى لا
we
ننقطع
are
تماما،
working
حتى نستمر في تقديم الخدمة.
we are
كل
trying
شيء يمنع،
to
ورغم ذلك نستهدف.
actually economize
طبعا
in
يعني
order
من
not to
أعظم
stop.
المشاهد
Everything is prevented,
وأدمى المشاهد
and
التي رأيناها في هذه الجولة
one of
في
the
هذه
most
الحرب
difficult and
هي
most
مشاهد
bloody scenes that we have seen
إنه عدم
during
مقدرة
this war
المصابين
is the
إلى
inability
المجيء
of the
إلى
injured
المستشفى،
to
لأنه لا
come to
توجد
the
مركبة
hospitals
إسعاف
and
إلا
to
في
receive
أنفسهم.
self
يعني من يستطيع
health
أن يصل بنفسه فهو محظوظ،
services,
وإن كانت
because
الخدمة
we don't
تقدم
have
بالحد الأدنى.
ambulances. If they are
ومن لم
lucky, they
يستطع
can come
يترك في الشوارع
on
حتى
foot.
يموت. هذه الحقيقة.
Otherwise, they will
وما يدمي
just be
قلوبنا
left
وما يحدث
on the road to die.
ويعني
What happens
وما
here
عايشناه في هذه
is,
الأيام الصعبة،
and what we
عندما
have been
نتلقى
living
نداءات
during these
استغاثة من
difficult
أناس
days,
تحت
is that when
تحت
we
رسام من
receive
أطفال يبكون
calls
ونساء
for
تستنجد وتبكي،
distressed calls
تستنجد
for
بنا
women, from
لأنه نحن
women and
المنظومة
children who
الصحية
are
الوحيدة في
crying,
شمال قطاع
calling
غزة.
us to provide them
وللأسف
with
لا
health,
نستطيع
because
أن
we are
نفعل
the
شيء
only
ولا نستطيع أن نقدم
health
شيء ولا
facility in
نستطيع أن نخرج
northern
بالإنسان
Gaza, but we
للمستشفى،
cannot
لأن
reach them.
كل
We cannot
شخص بيتحرك
provide them
في
with
أي وقت
anything,
كان
because
يتم
whoever
استهدافه.
goes out from the
طبعا
hospital
هذا
is targeted.
يعني
And
كانت
of
من أصعب
course,
الأشياء إنه أنت
these are one of
تتلقى نداء
the most
استغاثة من
difficult
هؤلاء
things, that
المواطنين ولا تستطيع
when
أن
you receive
تقدم
a
لهم
distressed
شيء، وفي
call and you
اليوم
cannot
التالي
actually
عندما
provide
تسأل
any response
يكون
or
الجواب إنه
provide
كل
any
من طلب
help.
الاستغاثة استشهد
And
وبقي تحت
whoever
الركام،
have
فأصبحت كل بيوت
called
هؤلاء الناس
for
تحولت إلى قبور لهم.
to
هذه
receive
حقيقة
help,
يعني.
they
وأصعب
have
مشهد
died,
إنه أغلب
their
العاملين
houses
الذين
became
يعملون في
their
المنظومة الصحية
they are buried
تم
in their houses.
إبلاغهم بنزول أو
And
باستهداف بيوتهم
they
وأهاليهم
were
وهم
told
يعملون.
that their houses have
يعني
been,
هناك
some of
3
the
أطباء
medical
دكتور نهاد الهموم،
officers and workers
وهناك الدكتور
have
طبعا اللي
actually been
هو
notified that their houses have been
هاني
destructed and
بدران،
their families have
وهناك
been buried under in those
الحكيمات،
houses.
الحكيمة اللي
And
هي
we have some of the female doctors
آية
who,
والحكيمة ريما، أيضا تم
Dr.
إبلاغهم
Aya
في
and
ذات
Dr.
المشهد
Rima,
إنه تم
they
استهداف
were
أهاليهم
informed
وهم
as well that their
نيام،
houses have been
وللأسف لم يخرج منهم أحد.
destructed while their
فمشهد
families have
كان
been
أصعب
asleep,
مشهد
and all of
علينا
them died.
عندما تم
And the
إبلاغ
last
آل
scene
الأعرج،
was the most
وهو
difficult when
يعني شخص يعمل في مرسلة
Dr.
بسيط جدا، كان
Mr.
هو
Al-A'raj,
يعني في
who is
المستشفى
working
موجود،
in
وتم
the
إبلاغه بأنه
morgue,
تم
he has
استهداف
been here
بيته،
and he
وكان هذا
has
البيت
been
يتكون
told that
فيه
his house have
يعني
been
يتكون من
targeted.
4 طوابق،
His house
وكل النازحين من آل
was made of
الأعرج والمحيط كان يسكن في هذا البيت وتم
four
استهداف البيت
stories,
كله.
and all
وتم
the
قتل
family from
أكثر
all
من 100
over
شخص.
the Gaza
وعندما
have
ذهبوا
been
إلى
staying in
المكان
that house, more than
وجدوا
40
أطفال
persons, and they have
مندفعين
all
من شدة
died.
القصف
And
إلى
when they
الشوارع
go
كانوا
there, they have
مستشهدين.
found the
وحاولوا
children
نقل هؤلاء
who
الأطفال،
have
فتم
been killed
استهداف
were just thrown
المسعفين أو
out
الناس التي تحاول إسعاف هؤلاء
in the streets. And
الأطفال.
even the people who
فتم وضع
tried
الأطفال جانبا حتى يعودوا باليوم
to
التالي
provide them
لعل وعسى
with
يكون
any
هناك
help
هدوء
have been targeted.
ويتم طبعا
And
نقلهم إلى
some of the
المستشفى.
people tried to went to
عندما
go
عادوا
there
في
the
اليوم
second
التالي إلى
day,
هذا
trying
المكان
to bring them
فوجدوا
to the
من
hospital. When they
25
go there,
طفل
they found
فقط متبقي
25
بعض
children.
الأشلاء، فتبين أن الكلاب الضالة أكلتهم ونهشتهم،
Parts of those
لأنه
25
للأسف
children
الشديد
which have been
لا
eaten
توجد
by the stray
يعني
dogs
إمكانية لنقلهم للمستشفى. هذا الشيء كان
because they
مبكي،
couldn't
وهذا
be
الشيء كان
transferred.
مزعج، وهذا الشيء كان يعني صعب للعقل
This was
البشري أن
really
يتخيل
difficult,
أطفال
and
تأكلهم الكلاب الضالة في العالم
you
الحديث.
cannot
نتحدث عن
you
2024،
cannot think
نتحدث
about it
عن
that children could be eaten by
المجتمع
stray
الدولي
dogs
بيتغنى
in this
بالديمقراطية
world, in
وبالقانون
this age,
الإنسانية
in this
وبيتغنى
era.
بحقوق
And
الإنسان. أين
people are
حقوق
talking
الإنسان
about human rights
والديمقراطية
and
والمجتمع
humanity.
الدولي من هؤلاء الأطفال
Where's the international
الذين
community?
أكلتهم الكلاب بسبب استهداف الجيش الإسرائيلي؟
Those
أنا
children
أستغرب كل
who
هذه
have been eaten by
الاستهدافات وكل
stray
هذه
dogs.
القنابل تلقى على مخيمات
I'm really
يعني كلها بنيان، يعني كلها كتلة
those bombs have been
حجرية.
targeting
لماذا؟
house, have been
نحن لا
targeting
يعني وكأنه
refugee
دولة
camps,
كأوكرانيا أو
and they are killing
كأوروبا
people.
طل الأف
When you talk about
35 تلقي
when you
أطنان من
talk about
القنابل، وهناك ريبورتات التي
like
تسجل في
Ukraine,
كل
they
الأماكن،
are using
وكأنه يعني
a
نحن
number of
دولة
bombs
تقابل
in
دولة،
our
كأنه دولة
small
تحارب دولة.
our
يا
in
أخي هذه دولة
small
تحارب مخيمات،
country. They
هذه
are just
المخيمات تسكن فيها آلاف من
targeting us
الناس،
with those bombs.
يعني
They are not
يتم
targeting
إلقاء
another
براميل
country. They are
متفجرات.
targeting camps
يعني هو
and
واضح
houses.
أنه هو
They
متعمد
are
يريد أن يقتل كل شيء اسمه فلسطيني في
bombing
الشمال.
us with shells, shelling us with
طبعا
bombs
كلنا
and
دفعنا ثمن في
barrels.
هذه الحرب.
And we have paid
نتحدث عن
a high
تبادل
price
النقدية
in this war.
المتبقية كانت في شمال قطاع غزة.
When we
تم
talk
اعتقال
about
أكثر من 46
the rest of
من
the
الطاقم
medical
الطبي
staff
المتخصص
staying in
بالجراحات، تم
Gaza,
اعتقالهم
a
ولم
large
يسمح
part of them have been
بإدخال البديل
detained.
عنهم،
The
وبالتالي
surgeons
أصبحنا
have been
نقدم خدمة
detained
في أقل
and no
الحاجات،
one replaces
ولا
them.
نستطيع
And that's
أصلا أن
why we
نقدم
are
خدمة
providing the minimum of
الجراحية.
services and we
فاضطررنا
cannot
أن
provide.
نتعلم الجراحات، وأنا
And
طبيب أطفال
that's
باختصار طب أطفال.
I'm a
تعلمت طب
pediatrician. I've
التخدير في
started
هذه
to
الحرب، اضطررت أن
I've
أتعلم
learned
هذا
during
حتى
this
أنقذ
war
أبناء شعبي.
anesthesia
وهناك
and
بعض
to be a
الأطباء
surgeon
الذين
in
كانوا
order to
يعملون
try to save
ببساطة
people.
في عمليات صغرى،
Some of
أجبرناهم
them have
وعلمناهم
been
بأن
working
يدخلوا
in
ويقوموا
small
بإنقاذ الحياة
small
وتم إجراء
stations. We
عمليات
have
معقدة على
taught them
الرغم من
how
أنه علم
to
الجراحات بجراحة
operate
عامة.
complex
والحمد
operations
لله
in
أنقذنا أكثر
general
من
surgery in
70
order to
مريض
help the people and save
كان
them.
بسبب
And
الاستهدافات
thanks to
المتواصلة،
God, we
ولكن
have saved
للأسف
more than
لم
70
نستطع أن نقدم
people who
خدمة
have been
العظام
targeted.
ولا
But
جراحة العظام ولا
unfortunately,
جراحة
we
الأوعية
couldn't
الدموية ولا
provide
جراحة المخ
any.
والأعصاب ولا جراحة الحلق، لأنه
We couldn't
أغلب
provide
هؤلاء
any
كانوا
surgeries for
يموتوا لعدم وجود هذه
orthopedics or
التخصصات.
uh, other small specialities because we cannot provide help. People died.
Annie? Now we go, even though the video is saying that everyone lost a lot and he lost his son, this man, Dr. Safieh. Now we go with Dr. Issam Abu Ajweh. We try to take all of the doctors, each one from different hospitals, so and different places. So to take a general view, we go with Dr. Issam Abu Ajweh, what I mentioned previously. He's a consultant surgeon at the Puppet Test Hospital. Sorry, now you begin. I just was introducing the doctor.
Yeah, I'm sharing now, Kifah. Thanks.
الرحمن الرحيم. أنا الدكتور عصام حسن رباح أبو
I'm
عجوة،
Dr. Issam
استشاري
Hassan Rabah
جراحة
Abu
عامل
Ajwa,
لوزارة
a
الصحة
consultant
الفلسطينية
surgeon
من
working for the Ministry of Health.
حوالي 30
And
سنة أعمل في
since
وزارة
30
الصحة
years,
الفلسطينية
I'm
كاستشاري
working for
جراحة.
the Ministry of
ومن
Health as a
7
consultant
أكتوبر وأنا
surgeon. And since
أعمل
7 October,
في
I'm
مستشفيات
working
القطاع،
in
وخاصة
the
في
hospitals of
مستشفى
Gaza,
المعمداني
especially in
كاستشاري أول في
Baptist
جراحة
Hospital
الجراحة العامة.
as a first
ومن أول يوم
consultant
في الحرب
surgeon. general surgeon. And since
استقبلنا
the first
إصابات
day of the
عدة
war, we have
متنوعة
received a
متنوعة،
variety of injuries,
وأكثر شيء كانت من المدنيين
and most
وخاصة
of them were
الأطفال
civilians,
وكبار
especially
السن.
children and
فكانت
elder
أعداد
people.
هائلة جدا
We
جدا،
have received a large number,
ورغم
a high
ذلك
number
إن
of
المستشفى
them,
من
and
صغرها، لأنه
despite
ما كانت
that, the
عندنا
hospital
أطقم
is
طبية
a
كافية إنه
small,
نتعامل
and
مع
we
هيك
don't have
حالات، لأنه عدد
the
الحالات اللي
the right
كانت
number
تفوق
of doctors who
الرقم
can
اللي
treat
ممكن
all
انه
those
تستوعب هذه
cases, because
المستشفى،
the cases
وكان
were
بعض
really high. We
المرضى
couldn't
او
accommodate all of
المصابين
them. Some
للاسف
of those patients or
ما
injured people
بانتظار لاجراء
were
العمليات
waiting
الجراحيه لهم،
for
فكانوا يفقدوا
surgeries,
الحياه
and they
لعدم وجود
died
غرف
because
عمليات واطقم
we don't
طبيه،
have
وكانوا
operating
يفارقون الحياه،
theaters or
وهذا
doctors,
كان اصعب
so
شيء
they
إلنا،
died.
انه احنا
And this was
كاطباء
one of the difficult
نحن نعمل على
situations.
مدار
As
الساعه،
doctors,
ولم
we are
نقدر
working
انه
around the
نساعد
clock, but we couldn't help
اللي
those
هو
people
الجرحى من كثر الحالات.
and those
وكانت
wounded
صلبات، انا
because of
حضرت عده حروب
the number of
من
cases. I have
حروب
witnessed a large
الانتفاضة،
number of
وحضرت
war,
كمان اللي هو مسارات
الانتفاضة,
العودة،
and
فلم نتعرض
a number
لهذه
of wars.
الإصابات
We haven't
كإحنا
seen
كأطباء.
this number of
حجم
injuries
هيك
as
كم
doctors,
الهائل
and
من
this
المدنيين
huge number
خاصة
of
الأطفال.
civilians,
جزء
and
كبير
especially
كان
children,
جزء كبير من
and
النساء
a large
والأطفال.
number
وأنت
of
يصعب
the
عليك أنت
injured were
كطبيب
children and
إنك ما
women.
تقدرش
And you as a
تقدم. حتى
doctor,
أنا
it's very
في
difficult
قصة
for
يمكن
you.
إنه
Even
من
me, there's
عائلتي
a story from
لما
my
نقص في
family
بيتي، إجا
when my
15
house
واحد من
was
عائلتي،
bombed.
استشهد
13 of
بعض من
members of my
عائلتي
family
وبعض
were
أصيبوا،
injured, and
ولم
some of
أقدر
them
أنا
were
أقدم
died,
الخدمة لعائلتي
and
أنا
I
كشخص،
wasn't
لأنه
possible to
غرف
provide
العمليات كانت مشغولة.
health care
وين
for
بدنا
my
نقدر إن
family
إحنا
members because the
نوفر لها
operation
مكان
theaters were
للعمليات،
occupied.
وهذا غير هيك.
We couldn't provide them. I
كنا
couldn't provide them with help.
نحاصر.
And we were
في يوم
sieged. We were trapped
من
in the
الأيام
hospitals.
حوصرنا في
In one
مستشفى
of those
المعمداني،
days, we have been sieged in
وبقينا
the
ما يقرب
Baptist
3
hospital, and
أيام
we stayed
وإحنا
for 3
محاصرين.
days under
وغير هيك
siege,
في
and
مرة
we have
إنه
been trapped there.
تم قصف
And
المعمداني،
one time the
المستشفى،
hospital was
وهناك
bombed,
كانت الكارثة
and
الكبرى.
and that
عشرات
was
بل
a big
مئات
disaster.
من
Tens and
الشهداء
hundreds
والإصابات.
of people
أنا
died, and
كنت مذعور
hundreds of
جدا،
them were
لأني
injured.
مش
I
عارف من وين
was
أبلش
horrified, and
كجراح، مين اللي
I
هو
didn't
أولى،
know
لأنه
where
إحنا
to start.
في
As a surgeon,
الجراحين بنشوف اللي هو
who is a
مين
priority. We
اللي
were
ممكن
trying
ننقذه.
to
أما
find
إذا في
those who
حالات
we can save.
صعب إنقاذها، فكنا
But if the case
نسيبها
is
اللي هو
difficult and could
اللي
not be
ممكن
saved, we
إنقاذه
just
عشان
let
ناخده على
them to
غرفة
die.
العمليات. وأنت
And
مستشفى كالمعمداني هي مستشفى خاص،
the Baptist
هي
hospital is a
ليست تابعة
private
لوزارة
hospital,
الصحة،
and it's
هي
not
تابعة
affiliated to the
للكنيسة،
Ministry of Health.
الكنيسة
It's
الأخوان
affiliated to the
المسيحيين.
church,
ولكن
to the
اللي هي
Christian
كان عندنا
church,
بس فقط 3 غرف عمليات
but
بالحجم
there's
هذا
only 3
الكبير.
operating theaters
ما
for this
يقرب
large numbers
كان عندنا ما
of
يقرب فوق 1000
injured.
إصابة
We received more than
وشهداء.
1,000
وتعاملنا مع هذه الحدث،
injuries and
وكانت فاجعة،
martyrs,
وكانت لنا
and
صدمة
it was
إن
a real
كأطباء إنك أنت
shock for us, and it was a
تحت
tragedy
رجليك في
for
العمليات في
us.
جثث،
We
تحت
just
رجليك في
we are
دم،
working
فرق من
we are
الدم،
operating, and
أشلاء.
a large we
والناس
are
كانت ما هي مش عارفة إيش تسوي، تجيب
people were
الناس كل
dead
واحد
under
يجيب
our feet, and
ويدخلوا في
we were
العمليات،
working in
وكنا
pools of
نمشي فوق
bloods, and
الجثث،
we were
كنا
walking over the
نمشي
bodies,
يعني
and
كأنه في بركة من الدماء، بركة من
we were
الدماء.
walking in pools of bloods,
فللأسف
and
يعني هذه ما أنا
unfortunately,
شاهدته
this
فيها،
is what I have
وبقيت على رأس عملي
seen,
من أول يوم،
and I
من
have
يوم
been working there
اللي هو
since
ما
the
قام
first day
الاحتلال
of the
بقصف
war, since the
المدنيين.
occupation started to
وبعد ذلك
bomb the civilians, and
تم اعتقالي
after
من
that
داخل
I
المستشفى
was arrested
ونقلونا إلى
from inside the
الخط
hospital.
الأحمر،
I was
ومكثت
transferred
هناك
to the Green Line, where I
حوالي
have stayed
213 يوم
for
داخل سجون
213
الاحتلال.
days
وها أنا
in
عدت
the
وأنا
occupation
على رأس
prisons,
عملي،
and
وإن شاء
now
الله
I'm back and
نكمل
I'm
المسيرة.
working, and I wish
وهذا
that
كل
we
ما عندي
can
أقوله.
provide help, and this is just what I've wanted to say. Thank you.
Now we go with Nebal.
الآن
Nebal Farsakh, she's the spokesperson of the Red Crescent. Nebal.
Good evening. Thanks for having me. Since the beginning of the war in Gaza, Israel is systematically targeting the healthcare system and hospitals, medical personnel. Most of Gaza hospitals were taken out of service, 17 out of 36 hospitals. And the hospitals that are still operational, all of them are partially operational. None of the Gaza hospitals currently are fully operational, and all these hospitals are lacking medications, medical supplies, along with fuel, which is needed for the power generator. As the Palestine Red Crescent, we provide healthcare services through our hospitals and medical points, in addition to providing emergency medical services, transporting those who are injured to the hospitals, transporting the dead bodies as well. And unfortunately, despite humanitarians and medical personnel should be protected and respected, the Palestine Red Crescent facilities, along with our colleagues, teams who are working on the ground, are being targeted repeatedly. We run two hospitals in the Gaza Strip, which is Al-Quds Hospital in Gaza City. This hospital was attacked, besieged, and taken out of service at the beginning of the war. Several attacks happened at the hospital. At the same time, there was complete besiege where no fuel allowed to get in. Then the power generator stopped, there was no electricity, and even Israeli forces refused to allow the entry of food for the patients and the staff, and then everyone were forced to evacuate the hospital, along with 14,000 civilians who were taken shelter inside the hospital. The hospital later was burned out, and all of its medical equipment inside damaged. And now, even if the war ends, we will need time to be able to reoperate this hospital again. We run also Al-Amal Hospital in Khan Yunis in south of the Gaza, which is one also major hospitals in the south. At Al-Amal Hospital, we provide healthcare services for the patients. As you know, hospitals and primary hospitals can barely save the lives of those who are injured because of the bombardment. We try at the Palestine Red Crescent to provide various healthcare services to the patients, pregnant women, people with chronic diseases, and others. And unfortunately, also at Al-Amal Hospital, the hospital was attacked repeatedly. It was taken out of service, and gladly we managed to reoperate the hospital again. Several attacks and shelling for the hospital itself and at the surrounding area of the hospital. Many of our staff were killed while being trapped inside the hospital, trying to save other people's life. The hospital was raided, and Israeli forces arrested and forcibly disappeared many doctors and medical staff, along with other Palestine Red Crescent teams from inside the hospital, and they were arrested, as I just said. Gladly, we also managed to establish medical points. We're talking about almost the 26 medical points and the clinics that are in all of the Gaza Strip, trying to provide healthcare services for the people in need, especially the internally displaced civilians who are lacking access to healthcare services. And 9 of our medical points were taken out of service because of the ongoing violence. 4 of them are in the north of Gaza. Since the beginning of the attacks in north of Gaza, 4 of our medical points there were taken out of service. 19 of the Palestine Red Crescent team members were killed while on duty, despite wearing the Red Crescent emblem. Many of them, despite being part of coordinated mission. Unfortunately, Israel does not respect international humanitarian law. When we talk about Palestine Red Crescent teams, we wear the Red Crescent emblem. All of our ambulances have very clearly marked the Red Crescent, and unfortunately, our ambulance was bombed, and I have lost all of this number of colleagues. It is horrific. It's unimaginable. We have never witnessed such horror and attacks. Not only lost my colleagues, dozens of others were injured. More than 30 of my colleagues were forcibly disappeared and detained. 4 of them are still forcibly disappeared for almost a year. There is no information about them. Israeli forces refuse to announce any kind of information about them, and we are extremely worried about them, taking into consideration that our released colleagues have spoken about mistreatment and the attacks and humiliation they endure during the time when they were forcibly disappeared. Under international humanitarian law, hospitals and medical personnel should be respected and protected. No patient should be killed while lying on a hospital bed. No doctor, a nurse, or medical personnel should be killed. But since the beginning of the war in Gaza, this is still happening. And unfortunately, it's still allowed to be happened with no serious measures from the international community to protect medical personnel and the humanitarians, so we will be able to continue providing our life-saving services. 50 of the Palestine Red Crescent ambulances were also damaged while trying to save people's life because of the systematic attacks for ambulances and medical personnel. As I just said, we also struggle to continue providing our emergency medical services as we are systematically denied access to all the areas that Israeli occupation forces are operational. Right now in north of Gaza, none of our ambulances are able to work there, despite receiving hundreds of calls from civilians who are trapped, who are injured, those who need to be evacuated. There's also elderly people or people with disabilities who need to be evacuated. And unfortunately, because we are completely denied access to such areas, we can't even send an ambulance or a crew because they will be targeted and killed. We managed to evacuate a number of patients while being part of coordinated missions, which is coordinated by the ICRC or the WHO. And even this coordinated missions to evacuate patients from Gaza North hospitals, we're talking about the 3 hospitals, they are besieged, lacking medications, medical supplies. So many patients need to be evacuated to other hospitals to save their lives. And even these missions are very lengthy. We need to get approval from the Israelis. And even despite the coordination, Israeli forces still obstructing the passage of the convoy. Patients have to wait long time at checkpoints before being allowed to pass. And our paramedics and medical personnel have been working tirelessly and selflessly for the past more than 1 year. And unfortunately, we are not allowed to rotate our teams, despite we try to send our emergency medical technicians from the West Bank to go and support their colleagues in the Gaza Strip. Unfortunately, Israeli forces does not allow this. And our teams continue to work to continue to save lives, despite the risk they face every single day. Despite every one of them, when they leave their home, they are not sure if they are going to meet their families again at the end of their shift, since they have lost a lot of colleagues and we're lacking medical supplies. We're working under very horrific conditions, but we are trying our best to save people's life. We continue to call on the international community, despite we have called a lot, billions of times since the beginning of the war in Gaza, but we will continue also to call for the importance of the protection of medical personnel and hospital. This should never ever be allowed to happen, and such attacks should never be normalized. We need protection so we can continue providing our life-saving services. And I also emphasize this systematic targeting of our colleagues, despite being part of coordinated missions, as what happened with my colleague Mohammad Al-Umari, who was part of a coordinated mission to evacuate patients from Al-Ahli Baptist Hospital and Al-Shifa Hospital in Gaza City to the south. Israeli forces opened fire at the convoy of the ambulances, despite receiving the green light, despite, as I said, this was a coordinated mission by the ICRC, and this has resulted to the killing of my colleague Mohammad Al-Umari and endangered the lives of patients who were children inside the ambulance, needed to be evacuated to receive a proper treatment.
Thank you, Nebal. You finished? Because we are late of time. Did you finish, Nebal? Sorry.
Yes, I am.
Thank you. Thank you very much for your participation. Right now, we go with Annie again, Dr. Aghyed Al-Mobaid, Head of Oral and Maxillofacial Surgery Department at Shifa Hospital. Annie, would you please be heard? Dr. Aghyed. Yes.
دكتور الأغيد.
Annie, please share the video.
Sorry for the delay. I'll just play it now.
Okay. Dr. Aghyed.
No.
السلام عليكم. معكم دكتور أغيد المبيض،
Peace be
استشاري
upon
جراحة
you,
الوجه
Dr.
فكين
Aghyed
ورئيس قسم
Al-Mobaid,
جراحة الوجه فكين
Head of
مستشفى
Oral
الشفاء في
and
غزة. اليوم حابين نحكي عن الأوضاع اللي مرينا
Maxillofacial
فيها
Surgery
قسم
Department in
جراحة وجه
Al-Shifa,
فكين
Al-Shifa
وكجراح وجه
Hospital. I
فكين
would like to talk
في
about what
الحرب
we
اللي
have
مضت
seen
علينا.
in
احنا
Gaza
حاليا
during this
متواجدين في
war.
قسم جراحة الوجه فكين اللي
Now
هو كان
we are
سابقا.
inside the
طبعا نتيجة
department for
التدمير
oral
والحرق
and
للقسم لم يتبقى أي شيء من
maxillofacial
أجزاء
surgery.
القسم
It
باستثناء
was
الحوائط زي ما احنا شايفين، وتم إعادة تأهيله
and
وتحويله
just
إلى
you
قسم
can see
للعمليات
it has been
الجراحية
destroyed,
الصغرى.
but
حاليا
we
ليس
have
لدينا
changed
قسم
it
جراحة وجه
into
فكين
an
بانتظار إعادة تأهيل
operation
قسم آخر
theater. Now we
لنا،
don't have
ولكن
a
نحاول
department. We are
قدر الإمكان
waiting
نقوم
for
بالعمليات
the
المطلوب منا.
rehabilitation of
في
another
الفترة السابقة
department,
كنا
but we are
بنعاني
trying
كثير
to operate.
من
We
الإصابات
have
اللي
been
كانت هي
suffering
شديدة القسوة بالنسبة
from
لنا، مش بس
the
جسديا ولكن نفسيا.
injuries.
الأطفال الكثير اللي كنا
It's
نشوفهم
not only
مصابين،
the we have seen a large
الأهالي
number
اللي
of
كانوا
children,
يجوا يسألوا عن
injured
أطفالهم،
children,
الجرحى اللي
and
كانوا يجونا
parents who
بأرقام،
came
كانوا
to
يجونا
ask
كثير
about
جرحى بأرقام، وما في عنا أي آلية للتواصل مع أهلهم،
people
وبعض
and the
الأحيان كان الناس
injuries who
تتوفى
came here,
ونضطر
and we don't have
نكفنهم
any contact with their
بدون أي
families.
قدرة
And sometimes we just
معرفة
we
أهلهم
would
أو
try
معرفة
to
أي حدا منهم، أو
treat
بعض الأحيان
them
كان
without knowing
عائلات بالكامل
their
يتم
families. And sometimes we
استشهادهم
receive
بدون أن
entire
يبقى لهم
families
أي من
who
الأقارب.
who
إحنا كقسم
died
جراحة وجه فكين في
with
الواقع
no
في البداية كانت
other
الحالات
member
عنا
of
إصاباتها
families.
شديدة.
We
أنا
have
عاصرت كل
tried
الحروب
at the
اللي
beginning.
تم
We
شنها في غزة
have been
بداية من
facing difficult injuries.
2008،
I've
ولكن
been
هذا
here
طبعا كانت
during all
الأشد
the wars
قسوة
that have
إيلاما بالنسبة
taken place in Gaza, but this one
احنا
is
طبعا
the
كقسم
worst of the
جراحة
wars.
وجه فكين
Has
في
a
البداية كان في عندنا
department for
قدرة على
oral
تنظيم
and
آلية العمليات والعمل
maxillofacial
من غير
surgery
إشكاليات
department.
كثيرة. يمكن
We
كانت
at the
الإشكاليات
beginning
تكون إنه
we
كيف نحجز
have been
غرف عمليات
operating
لنا. كان
without
غرف العمليات
problems. The
تعتبر نوع
only
من
problem was
الرفاهية،
to
ونحاول قدر
book
الإمكان
the
إنه نشتغل
operation
حالات اللي هي
theaters, and
محتاج تخدير كلي
we
نعملها
have
تحت
been
تخدير موضعي،
trying to
برغم إنه هذه كانت ظروف
work
كثير صعبة على
those
المرضى وعلينا إنه
who
نشتغل
needed
عمليات
anesthesia.
تركيب
We
شرائح
tried to work with
ومسامير
partial
وإعادة
anesthesia. We
كسور ورد
tried
كسور
to put
على
to work
كرسي أسنان
on
نتيجة إنه ما في
injuries,
عنا
on
أقسام جراحة وجه فكين متاح لإلها
work those
غرف العمليات،
operations
إنه كان
on
غرف
actually
العمليات عنا محدودة
dental
وعدد
chairs,
الإصابات كبيرة،
and
وفي أقسام
we have
بحاجة
a small
إلى
number of operation theaters, and
للعمليات هذه
the
أكثر.
numbers of injuries were very
إحنا
large,
كنا
and we
متوقعين
needed
صراحة
to
كجراحين وبناء
do
على
those
خبراتنا
operations.
السابقة إنه الموضوع يستمر بحدود
Because of
شهر أو
our
40 يوم، ولكن إحنا
experiences, we
في
thought that
أسوأ
this would
كوابيسنا
go on for
بصراحة ما
40
كنا
days or
متوقعين
a
إنه
month,
تستمر كل
but
هذه الفترة.
in
إحنا للأسف
our
الشديد طبعا في أول فترة
but we
صارت
did not
الضغوط
actually
شديدة هنا وغادرت
think that it
المنظمات
will go for this long time.
الدولية
We
وبعض
have been
المؤسسات
suffering a lot. The
والأجانب
international
غادروا
institutions have
غزة
been
هان باتجاه
evacuated. They
الجنوب
left
نتيجة تحذيرات
Gaza, and
الاحتلال الإسرائيلي.
because
صار في
of
عنا نقص مهول بالكوادر، لأنه إحنا كمان
the
بدنا
calls
ننتبه
from the
جزئية هامة كثير،
occupation,
إنه إحنا
and
دول
that's
أطباء
why
والجراحين
we have
والتمريض والطواقم
lost a large
الطبية
number
بشكل
of
عام، كل
support,
واحد عنده
because most
عائلته.
of the
يعني ما
nurses
هي
and the
قصة بس
doctors, they have
قصة
their
إنه
families,
إنه
and
لا
it's
أنا بدي
not
أشتغل، يعني
only
هو ما
about
مش بس
working
كشخص وعم
and I
يفكر في
want to
عائلته،
work.
وهذا كان إحنا
He's not
واجهنا
only
كمشكلة.
a
أنا
person.
شخصيا
They are
حصلت
thinking
لمدة
about
6
their
أيام
families. I have
في
been
عيادتي
trapped for
نتيجة إنه
6
نزحت
days
لإلها،
in
وكانت
my
6 أيام من
clinic
أسوأ ما يمكن. تم حرق
and
سياراتي،
those were the
تم
worst
إطلاق
6
أنوار
days of my
داخل
life,
الشقة اللي كنت
and
متواجد فيها،
I have been
أنا وأطفالي.
I
صراخ
have been
دائم، ما في مي، ما
attacked.
في أكل وشرب.
With my
وطبعا زي ما أنا
family, my
عانيت كل
children have been attacked,
شعبنا
and we have been under
عانى.
fire.
طبعا
We have
المعاناة
suffered.
صارت
No
مضاعفة
food, no
إلنا
water, and this
بعد
is
هذه
the
الفترة،
suffering of
بعد
all the people
خروجنا
in
من
Gaza.
مستشفى
And this,
الشفا.
after we went
توجهت
out from the
لمستشفى المعمداني
hospital,
عشان نحاول إعادة
Al-Shifa
تشغيله
hospital, I went
بدون
to the
أي نوع
Baptist
من أدوات
hospital.
جراحة
So
وجه
I would
فكين،
like
لدرجة
to
إنه إحنا كنا في بعض الأحيان
try
نضطر
to
نستخدم
work
أسلاك
over there without any
كهربائية لإعادة
equipments, and
تثبيت
sometimes we
كسور.
used
وهذه طبعا كانت
electrical
أسوأ
wires to
فترة مرت في حياتي
refix some of the fractures, and
كجراح،
this
وما
was
كنت
the worst
أتوقع، يعني أسوأ
time of
كابوس
my
لإلي.
life
عمري
as
ما
a
توقعت
surgeon.
إنه أضطر ألجأ لهذه
I didn't
الأنواع
think about this
من
in the worst of my
العلاجات
nightmares, that I will do
لمرضانا.
this type of treatment
حاولنا نشغل المعمداني
to
بعد
our
فترة،
to the people.
تم
We
إخلاء
have tried
مستشفى الشفاء،
operating
رجعنا
the
له،
Baptist
أخذنا
hospital
شوية تجهيزات منه
after
عشان
they
نشغل
have
المعمداني،
went
شغلنا
out
له
from
فترة
the
معينة.
Shifa
وبعد فترة
hospital.
معينة قالوا لنا
We came
لا
back, we
الشفا
took
حترجع
some
تشتغل، رجعنا
medical
شغلناها
equipment, we went
لمستشفى
back to the
الشفا،
Baptist,
وانتظم
and
العمل
then
فيها
we
لفترة
came back to
كتير
Al-Shifa when
كويسة.
they
وبعد
started
هيك
working
تفاجأنا
again,
إنه
and
رجعوا
we
مرة
have
ثانية
worked for a
دخلوا عليها،
while, and
ولكن
then
هذه المرة
after
كانت
a while
الأسوأ
the
على قلوبنا.
occupation came in
دخلوا
the
فيها وتم
hospital
حرق
for a
المباني
second time,
الرئيسية
and
فيها،
this
مبنى
was for a
الجراحة
third time, and
والعيادات
this was the
الخارجية،
terrible
المباني كلها. احنا
experience.
في آخر
They
الفيديو
have
حنحاول نورجيكم صورة مباشرة لهم.
burned and
وطبعا
destroyed all
لما
the
أخلوها،
buildings, the
احنا
main
فترة كنا قاعدين
buildings.
عم نشتغل
I
في
will show you
مستشفى
some pictures. And
المعمداني.
when they
لما تم
evacuated the
إخلاء الشفا
people,
رجعنا،
when
وللأمانة
they
يعني أنا
evacuated
حسيت إنه
Al-Shifa,
يعني
I came
إنه
back,
زي واحد
and
طفل من
honestly, I
أطفاله
felt that I
استشهد
was
لما
just
شفنا
like
الحرق
it
لهذه
was one
المباني
of
اللي
my
احنا
children
عاشرناها
who
على
died
مدار
when I've
25
seen the burned down
سنة.
buildings that
طبعا
where
الإصابات
I've been
احنا
working
اللي
for
كنا
25
بنشتغلها
years. And the
اضطرينا
injuries
إنه
that
نعمل
the
الجراحات
injuries that we have
الأساسية
been working
بسبب
on,
نقص
we
مهول
have
وكبير
been
في
forced
الشرائح
to do only
والمسامير والمعدات
the basic
الجراحية.
basic
حاولنا نشتغل
operations
قدر
because
الإمكان.
of the
هنحتاج في
absence of
المستقبل إنه نحول
the
جزء كبير من
equipments, the
مرضانا
medical
هدول
equipments.
اللي حيحتاجوا
And
لزراعة عظم،
we believe that in
لتأهيل
the
بعد هيك.
future, some
وإحنا
of
برضو
a
نفسنا إحنا
large number of
كجراحين
our
بحاجة إعادة
patients
تأهيل،
will
حنحتاج
need
دعم،
to be
شتى
rehabilitated,
أنواع
and we
الدعم.
as
كل ما
surgeons, we
تتخيلوا من
will
دعم
need
حنحتاجه
rehabilitation.
لإعادة بناء
We will
مستشفى
need
الشفا. وإن شاء الله الله
support,
بيكتب لنا عمر عشان نرجع
whatever
نشوف
type of
مستشفى
support to
الشفاء
rebuild built
من جديد.
the
بهمتكم
Shifa
بهمة كل
hospital, and I
إخواننا
hope I wish to live to see the
المثابرين
rebuilding of
واللي
the
واقفين
Shifa
جنبنا
hospital,
في
and I wish
إعادة
that
دولتنا
I would like to
الفلسطينية.
thank all
شكرا
those
لكم.
who are standing by our Palestinian
يعطيكم
people and
العافية. أنا وعدتكم في آخر
standing by
الفيديو
our
أن نورجيكم صور مباشرة
I
من مستشفى
promised you
الشفاء
to
أو ما
show you
تبقى
some
من مستشفى
pictures
الشفاء.
of
طبعا هذا المستشفى له
the rest
رمزية
of
كبيرة
the
عنا
Shifa
في
hospital.
مدينة غزة.
This hospital
وطبعا
have been
أنا
very
بعتبره زي
symbolic
كأحد
Gaza,
أولادي
and I consider it
لما
one of
طلعنا
my
ورجعنا
children.
ثاني مرة
And
وشفنا
when we
المباني
went
هذه
out and we
المحروقة
came
اللي
back,
عايشنا
we
إحنا
have seen
فعليا
all those buildings
بنائها
that
من
have been
حجر الأساس
destroyed
لغاية
and
ما
burned down.
كبرت وصارت
We have been there
زي هيكل
witnessing its
اللي وضع
building
حجر الأساس في
when it was
البداية
being built.
الرئيس ياسر عرفات الله يرحمه،
Yasser
وعشنا لغاية ما
Arafat,
شفناها صارت تنبنى.
the
طبعا هلا
president
كل هذه
Yasser
المباني
Arafat has
قايلة
started building this hospital.
Now we go with the testimony of Dr. Mohammad Irran, consultant of general surgery and oncology surgery from the Indonesian hospital. Annie? And of course, you know, we get them on videos because they have like technical issues. We didn't manage to get them live with us, the doctors. Annie, please, yes. Dr. Mohammad Irran.
In the name of God, the most merciful, the most compassionate. Peace be upon you all. I would like to thank you.
Try to double click on it or something to the video.
Today, I'm going to talk about what happened in our hospital. I'm Dr. Mohammad Ibrahim Arran.
To share it because it's not showing the video. We hear the voice, but we don't see the video.
Yeah, let me try again. No?
Yes, it's okay.
Thank
It's
you.
now working, yeah.
I'm Dr. Mohammad Ibrahim. I'm a consultant of general surgery and oncology surgery. I've been working for 30 years in Al-Shifa hospital, and now I'm working in Indonesian hospital, and I've been the head of the surgery department until the beginning of the war. As my experience as a war, I've been living through wars as a technician, as a doctor, as a displaced person, and according to this, I have lived many horrors, and unfortunately we don't know which one is more difficult than the other, and what our people are living through and what we are living through is really difficult. And I'm not going to talk about myself, I'm going to talk about the medical personnel who are working with us, who have been attacked, who have been just like our people have been slaughtered, have been murdered, have been tortured, have been detained. And I'm not talking about Dr. Mohammad Irran. I'm talking about in the Indonesian hospital. The Indonesian hospital have been resilient despite being attacked until it was invaded by the occupation army. Since the beginning of the war, it has been evident that it's not a normal war, it's a genocide war. And the most difficult thing was that they have been targeting people, trees and walls, and even walls. And it have been witnessed by the international community. They have been seeing everything and witnessing it, seeing slaughter and terror and displacement and starvation, finally starvation, the displacement and the imprisonment and the torture and the abuse and the humiliation. They have been witnessing this since the beginning, and it was evident that it's not an ordinary war, it's a genocide war, a war of extermination. The medical personnel are part of these people. They have been attacked and targeted just like the rest of the people. A large number of our colleagues have been killed. They have been targeted. We have lost 150 doctors. May peace be upon their lives, upon their souls, and upon the souls of all the martyrs. We have a large number of children who have been orphaned. We have a large number of families who have been destroyed, completely destroyed, and concerning a large number of the health personnel have lost their lives or they have lost their families. 5 minutes is not enough to talk about what happened, but I but it's very important to talk. The most difficult thing was that we were not able to go do our work in the governmental hospitals because of the large number of injured people. Sometimes we received hundreds, and sometimes it's impossible to accommodate them in the hospitals. And we were continuing to work, and we look at these people losing their lives. We are just being watching them losing their lives without being able to do anything to save them. And one of the things that I will never forget is seeing the children who have been shattered, who have been charred and burned, and or losing their parents and their siblings. It was very difficult. It was a second disaster. It was that our medical staff have been exposed and targeted. They have been displaced and starving and abused and imprisoned and killed and tortured as well. And finally, I want to say that I will talk about the circumstances of the prisons. I've been imprisoned. It's not the normal prisons for the majority. It was more difficult than Guantanamo. We have been in individuals. It's not in individual cells. We have been tortured all the time. And collective punishment, and they are punishing everyone at the same time. And you can see that you stay for 24 hours handcuffed, and your eyes are locked, and you cannot do anything. We have been targeted by beating and torture and insulting, and we have been exposed to inhumane conditions in those prisons. And at the end, I would like just to thank you in my name and in the name of my colleagues, and I wish that our colleagues will get out of prisons, and I wish them speedy recovery, and I would like to console those who have lost their families and their dear ones. Glory for our martyrs, and we wish the speedy healing for our wounded, and we wish that our families will return to their homes, and we wish that God will end this war, and maybe you all be blessed.
Now we continue with Dr. Hamada Ghabboun, anesthesia and intensive care specialist from the European Hospital in Gaza. Yes. It's not showing.
I'm Dr.
Again, try to.
I'm Dr. Hamada Al-Ghabboun, anesthesia and intensive care specialist in the European Hospital.
Annie. Thank you, Annie.
Just 1 minute, Dr. Kifah. Now, are we good?
Yes, we're good.
Perfect. Thank you so much.
I'm Dr. Hamada Ghabboun, specialist of anesthesia and intensive care in European Hospital in Gaza. Over the 430 days in Gaza during the war, we have been witnessing destruction and displacement, and I've been here in this hospital since the first day of the war, and we have been receiving injuries caused by the bombing of houses, streets, and schools. And we have faced a large number of injuries, more than the capacity of the hospitals. We have been receiving them. Among them, we have children and youth and elderly people. The injuries were different depending on the type of bombing. And so when a house is bombed, the injuries could be amputation and bruises in the abdominal and chest bruises, and third degrees burns and second degrees burns. And this shows that those wounded have been bombed. And when drones will attack people. The wounded will have fractures and burns all over their body, and because of the large number of injuries and the need for operating theaters, we have uh, we have been changing the recovery rooms into theater operation theaters, and we have to anesthetize some of the patients in the hallways, and we open operating theaters in those corridors. The large number of injuries and the lack of capabilities has led to the amputation, a large number of amputation because of the bleeding and the consumption of medical, the medical and the large number of injuries had led to the decrease in the number of beds in the units, in the intensive units, and sometimes we had to put them together in one bed in order to try to save the life of those who we can save.
ليش ما وقف؟ مش مشكلة
We were called one day to the emergency room. There was a large number of injured people, from children, women, and elderly, and most of their injuries were severe. And they needed intervention for intubation, for resuscitation, but the number of doctors was very small, and we could not. A large number of the doctors were absent because of the bombing of their houses and the displaced and they were displaced to other places, and we were forced to try to choose between the injured, try to delay some of them, and because of the lack of equipments as well, because of the bombing of some of the hospitals and the stores of the medical stores of the Ministry of Health. This has led us to use inhumane methods in operations to save the wounds, the lives. Sometimes we operate in amputation without painkillers, without anesthesia, because we don't have them, and this has led to some psychological problems. We have been doing things in order to save the patients, and that we will not. Some of those injured people were our friends, our families, our colleagues, and we have lost some of our colleagues because of the difficulty of the situation. And this the situation was really dire. We don't even know how to describe it.
And we should go with the anonymous testimonies. They are short. To continue, then we go to call to action. Later, we will have any questions if anyone wanted to ask anything. And we will replay the questions that we didn't yet on the chat. Please, Annie. Yeah. Try again, Annie. Try again, please.
This war faced in Gaza concerning.
It's not showing. Yes, right now. Yeah.
Concerning the difficulties we are facing or the constraints as doctors and workers in the medical field during this war in Gaza, we have been facing a large number of problems and difficulties, but the most important of them that have been reflected negatively on providing services and the rising of the number of deaths is the accumulation of citizens confined to places because of the displacement and the close down of some of the hospitals and the severe shortage of medicament and the absence of access to anesthesia if we take an example as the hospital of Yusuf and Najjar, it's a small hospital serving Rafah, which are made of 200,000 people. During the displacement, during the first 6 months, a number of Gaza went to Rafah, and the number have been doubled, and a large number of the hospital in Gaza have been closed down and destroyed, completely destroyed. So this hospital became the only one working and providing services for the Gaza people. And that's how the patient did not have a place to be received or sleep. They were sleeping on the floor with no beds. And we have been intervening to save the lives on the floors, in the corridors, with no beds, with no equipments. And we did not have access to antibiotics, or whatever medicaments to try to save those people, and this has led to a high prevalence of infection, and which it could be treated in simple ways if we find antibiotics, and they could be purified and improved. But that has led to increase of percentage of deaths and amputation of limbs and bleeding and poisoning and this has led to death in many cases. We have lost a large number of injured people who could have been saved if we just could have humane conditions in the hospitals and to have access to antibiotics and medications and solutions. Some of the difficulties we are facing as well, and we are still facing as medical workers, we are being threatening. We are working in unsafe areas that could be invaded, that could be bombed, that could be shelled. We could be killed, we could be injured. We are working and we are not safe. And in addition to this, we are facing other difficulties because of we have been staying for long periods in those hospitals, and we could not provide for our families and for our homes. And you know that there's a big shortage in food and in clean water in Gaza. As a father, and in addition to being a doctor and providing health care, we are actually obligated to provide food and water and clean water for our families, for our children, just that they can continue to live with the basics of life, with their basics needs. And many of the times we are confused. How can I just reconciliate between my work in the hospital and my responsibilities as a father? And in many times we don't know how to do it, and we don't know what to do. And these are difficulties we are facing. We are facing this during the war. It's the first time we are witnessing this type of war during I've been working for 20 years. I've never been in such a situation, and we have never been facing this semi-famine found in the country, or this dire situation in the country. And this is the responsibility, and it's a difficult responsibility to shoulder.
And we go with the last testimony, please.
And
try to do it again.
Do you see now?
Yes.
Yes.
Thank you, Anne.
The difficulties we are facing as health workers, we don't have a number of ambulances because they are targeted, and there's a severe shortage in fuel because of the siege and and the destruction of the roads as well that have been bulldozed by the bulldozers of the Israeli armies, and the absence of safe roads so that we can provide services for the injured. And the most difficult thing is that we are not safe during work. We are trying to evacuate injured, and we are the injured people, but we are targeted directly, and this has led to the death of a large number of our colleagues. And there's a shortage of equipment. We don't have clipboards. Most of the time we are using gauze, just like compressor bonds, and we are using wooden things to fix legs and to stop bleeding. And some of the difficulties as well, the situation that we have been exposed to, my personal experience, I have been targeted in a place, and we have been under heavy fire, and a number of my colleagues were injured, and God helped us, and we successfully went out of the place. And after that, we would like to add to all this suffering we are facing. We have been absent and working, staying away from our families when we cannot provide them with water and clean water and food. Our families are facing those difficult situations in Gaza, but we cannot provide for them because we are working in the hospitals. We cannot go back to our families, and we need to rest, but we cannot do this because of the scarcity of the workers in order to provide health care and to save the injured and transport the dead.
We finished with all of the testimonies. Right now, Dr. Al-Qawasmi, Mustafa Al-Qawasmi, he left right now because he has a critical case in the ER, so he apologized and informed me to apologize for all of you. Now we will continue with call to action with Dr. Fahed Al-Ghanem.
Hello.
Yes, Dr. Fahed, and then we will have questions. The floor is yours, Dr. Fahed. Tfaddal.
Thank you so much. I'm deeply humbled to be here among extraordinary healthcare workers who continue to persevere and save lives under the most unimaginable conditions. My name is Fahed, and I'm an intensivist practicing in the USA. I'm also a proud Palestinian from the diaspora. First, I want to extend my gratitude to the Palestinian International Friends Alliance, PIFA, the Campaign Against Racism, CAR, and Doctors Against Genocide, for organizing this vital press conference to spotlight the deliberate targeting of healthcare workers in Palestine. Today, I speak not only as a physician, but as a human being, compelled to amplify the voices of healthcare workers in Gaza and the West Bank, brave individuals risking their lives every day to save others. What is unfolding in Palestine is not a conflict. It's a humanitarian catastrophe, a calculated destruction of healthcare in one of the most vulnerable regions in the world. Hospitals reduced to rubble, ambulances shelled, doctors, nurses, and paramedics killed while wearing uniforms that should shield them from harm, not mark them as targets. These are not isolated incidents, but systematic violations of international law meant to dismantle healthcare systems and leave communities without hope. According to Amnesty International, this is genocide by attrition. It's a deliberate strategy to erode a population's ability to survive, and we must not allow it to continue unchecked. International humanitarian law, as outlined in the Geneva Conventions, explicitly protects medical personnel and facilities. Yet in Gaza and the West Bank, these protections are disregarded daily, turning hospitals meant to be places of healing into scenes of horror. When medics are killed while saving lives and when ambulances are bombed en route to help the injured, the message is clear. Even the most basic rights to health and life are under attack. But we are not powerless. We are a global community united by a shared duty to protect life and uphold human dignity. Today, I call on healthcare workers, medical associations, and human rights advocates worldwide to mobilize in solidarity with the Palestinian healthcare workers. I'm gonna leave the floor to Dr. Goronga, who's a very close friend of mine and an advocate for healthcare workers everywhere, to read the demands from Doctors Against Genocide.
Thank you very much. And my name is Dr. Goronga, and I'm from Zimbabwe. And here is what we must demand. Number one, stop bombing hospitals and attacking healthcare and aid workers. Violence against those who care for others must end immediately. Healthcare workers should never be targeted for their commitment to humanity. Number two, call for the protection of children in Palestine and Lebanon. The children who bear the greatest burden of this tragedy must be safeguarded at all costs. Their lives, futures, and well-being must be a priority. Number three, call for an immediate and permanent ceasefire, an end to the ongoing genocide to allow health professionals to resume. No health system can function under bombardment. A ceasefire is not optional. It is a matter of life and death. Number four, support a comprehensive and immediate embargo on weapons to Israel and divestment from Israel to stop the ethnic cleansing of civilians and destruction of healthcare. We must work collectively to stop the flow of weapons for fueling these atrocities and hold perpetrators accountable. Number five, advocate for unrestricted humanitarian and medical access to Gaza. Let's ensure medical supplies, aid, humanitarian efforts reach those in need without obstruction. Every delay costs lives. Number six, establish healthcare education and training at your institution for patient-facing staff to provide for patient-facing staff to provide informed care to patients affected by war crimes, crimes against humanity, and genocide. Equip healthcare workers worldwide with the tools to treat survivors of trauma and atrocities with compassion and expertise. We cannot afford to remain silent. Silence is complicity. We must act not just as health workers, but as humans who value life, dignity, and justice. Together, we can amplify the voices that are being silenced. Together, we can stand against injustice. Together, we can demand that healthcare workers in Gaza and the West Bank receive the respect and protection they deserve. Let us be the voice of those who have been denied theirs. Stand with health workers in Palestine. Stand for humanity. Thank you.
Thank you, Dr. Goronga. Right now we take questions. Ruth, I think, who's the one who was like keeping about the questions?
I think we can open it for people, Dr. Kifah, to raise their hands, and we have some in the chat already.
Okay.
To start with, we have one question from Esther Ramani regarding how is the changing situation in Syria affecting the genocide and the struggles of the Palestinian people?
I think the situation in Syria, it shouldn't be like reflecting on the genocide in Palestine. It should be like it's an internal issue inside Syria. The people, I hope that the people of Syria could get better future, better democracy in their own. But it's like taking the focus from the world, from the genocide to Syrian issues. Syria, now it's solved. Al-Assad left Syria. Right now they have like a intermittent government. So now we should like focus all of us on the Palestinian issues. So if there is any questions related to the Palestinian people or the genocide, please raise your hands. Or if there is any other questions were left, I didn't keep up with all of the comments on the chat and the questions, to tell the truth.
Yeah, Dr. Kifah, we have one from Mike Ludwig. If we can unmute. Let me try to. Yeah, let me know, Mike, if you can speak now, please.
Yeah, can you hear me?
We hear you
Hello?
perfectly.
Okay, hi, this is Mike Letter with Truth Out Thinks. I just wanted to follow up because I believe I heard from 2 doctors today that they were arrested and detained. Is that correct? I just wanted to make sure I understand who has been arrested and if there's anyone else on the panel who's been arrested, because I'm very interested in doctors actually being detained along with other prisoners. I think we heard from, gosh, I'm looking at my notes here, but I think we heard from at least 2 doctors, and I want to make sure that there wasn't anybody else, and that I can confirm that these 2 doctors were actually arrested and detained by Israel.
Yeah, they were. Yes, they were arrested from the Israeli, and Nebal also said that a lot of their cadres and Dr. Mustafa, when he was here, mentioned that all of the medical health personnel in Gaza, they were targeted with killing or imprisonment because they wanted to leave the people without any medical support, so to get therapy or something. It was like to enforce them to evacuate the places that the Israeli wanted them to evacuate. The doctors who mentioned that they got arrested, Dr. Issam Abu Ajiweh, I guess, if I'm and Dr. Mohammad. But right now we don't have them here because the problem was that technical issues in Gaza right now. We couldn't because of that we recorded the video. We
No,
couldn't.
that's okay. I just wanted to confirm that those
Yeah,
are the
and
they were
Mike, we
actually
will
arrested
upload.
and
They were
incarcerated,
arrested.
right?
One of them got arrested for more than 213. We will have all of these testimonies. We will upload them in our Facebook, and also if you put your email, we will send the recorded testimonies for you.
Okay, great. Thank you so much.
You're welcome.
Next question, Dr. Kifah, Casa Palestina de Aragon.
Yes.
Can you hear me?
We can't hear you.
Yeah. Can you hear me?
We can hear you now.
Excuse me?
Yes.
Okay. Thank you very much for the testimonies and for your work. We just want to ask you what else can we do from our countries? Thank you very much.
I heard the
didn't get the
question. I can repeat
Yeah.
it, that the Casa Palestina de Aragon wants to know what everyone can do from their own countries regarding the genocide.
We said that we want them to do a lot of stuff, by the way. First, there is to work to stop the genocide, to make all of the health organizations to take positions and statements regarding to put some pressure on their governments to try to take actions. The second issue is to support the sector health in Palestine, especially in Gaza and also here in the camps in the West Bank, because all of them were attacked and targeted. So if you are interested in some practical steps how you could support inside Gaza or here in West Bank, we could send you what we got from the Ministry of Health or even the Red Crescent.
Yeah,
And
thank
the
you.
hospitals
Thank you very much.
themselves. We will
I
send
would love it.
practical steps. Anyone who's interested in that, in the PowerPoint presentation, we put an email. Maybe we will put it in the chat also, please. If anyone is interested, they just send us and we will send them what they could do if they are willing to do something practical for the hospitals or for the people there.
Thank you very much. I put my email on the chat for this. Thank you.
Thank you.
Dr. Kifah, there is a question. How can we pressure the American Medical Association and American Pediatric Association to issue statements and take actions I think this is for Dr. Kifah or also for Doctors Against Genocide. If there's anyone on and wants to raise their hand, we can make you a panelist and speak to this.
For me, of course, this is what we want. So anything needed from our side, we could help to do so. Maybe also Dr. Fahd could be like the one. I don't know if anyone here.
I will just comment regarding you can follow Doctors Against Genocide, and we did this press conference with them, and what they're doing regarding American health organizations is providing a lot of, oh, perfect. Nebal is on. I'm making you panelist, Nebal. He's the coordinator of Doctors Against Genocide in this campaign. So perfect, Nebal. We can hear you.
Yes, hello. How's everyone?
Alhamdulillah,
Hello?
Nebal. We are good, alhamdulillah. Still
كيفك
surviving.
دكتورة كفاح كيفك؟
الله يسعدك لسنا عايشين يعطيك
Do you
العافية.
do you see me guys or no?
No, we don't see you.
We don't, but I can give
hear you.
permission.
I don't know why. I mean, is there a camera here or no? But anyway, Dr. كفاح يعطيك العافية. I know it's hard وصعب وشكرا لك على اللي بتعمليه. وخلينا كلنا نضل
difficult,
نشتغل مع
and
بعض وخلي
thank you
صوتنا
for what
عالي
you are
في
doing.
التوصيل
Let
أو
us work
هيلث كير أو
together
بالمنطقة
to
أو برا.
raise our voice in
So we're
Palestine,
all
in
in this
Gaza,
together, and our goal is
and
that the medical community. Okay. Okay, it's working now, yeah?
Yeah.
Okay, Dr. Kifah. So thank you for this. Thank you for all your efforts. It's really great work. And exactly, we are doing, you're doing exactly what we're trying to do here in the United States, which is to mobilize the medical community, both in the United States and globally, to break their silence, to speak up against the genocide, to speak up to protect the children, to speak up to protect the doctors, the hospitals, the nurses, the healthcare workers. And unfortunately, the healthcare community and the medical institutions, especially the AMA, have been very silent, very complicit in this genocide. That's why we're coming up with this campaign, because we refuse to continue to be silent. We think our moral obligation and our medical mission and oath is that we should be the first ones to speak up against these atrocities, against these crimes, war crimes. Doctors go to school literally to protect life. This is our job. And when politicians fail, when governments fail, when the international community fails, it is upon us as healthcare community to be the ones who try all what they can to protect life, the sensitive life, and to demand an immediate ceasefire, to demand an immediate arms embargo, to demand even deployment of peacekeeping troops to protect the children, to protect the hospitals. Unfortunately, the United States government and institutions, all of them have failed humanity. They are partners in this genocide, not just complicit. They are actual and active partners. And we should do, and we need to do as a medical community, all what we can to expose them and put them on the spot, and at one point hold them accountable for the crimes that they were complicit in, both Democrats and Republicans. I think this genocide would not have happened, would not have continued if it wasn't for the active support and funding and arming by the United States of America. United States of America at this point is on the wrong side of history. It is a genocide enabler, and morally they are fully responsible for this. Unfortunately, the international law was put in a way that major powers have the veto power that protects them. But that does not mean that this should continue forever. I think we should take an opportunity of this historical moment in history to change the international law, to change the veto powers, so no one is immune when it comes to war crimes, crimes against humanity, and genocide. We are actually calling to establish a medical body that is independent and that does have the power to call out these crimes, warn about them early on, try to prevent them when we can, and when we cannot prevent them, at least try to stop them, demand a ceasefire immediately, and hold the perpetrators accountable, regardless of politics, regardless of the major powers. It's not easy. It's a high aspiration, but this is what is needed. It will take maybe a long time to do this, but I think if we really respect our careers, our profession, our humanity, and respect all the victims who sacrificed their lives, we should make the best out of it and make sure that the international law is remade in a way that whenever there's a threat, a grave threat to human life, we define genocide as a massive public health emergency. Whenever the medical community determines this, that there should be ways and mechanisms to be deployed right away, regardless of any veto from the US or anyone else. And that includes also the American Medical Associations. We are trying to have more campaigns directed against them. We are trying to do that, not another child, not another hospital campaign in all medical institutions. We are in the beginning, but we're building up momentum. And at one point, once we have enough power, enough momentum, I think we can force these institutions either to listen to our demands or to be rendered irrelevant and complicit in the genocide, and at one point to be held accountable. So I hope I answered, some of your question. We don't have an immediate answer now, but again, this is a historical disaster, and this is a massive loss of a human life. If we make the best out of it and enact laws and mechanisms to protect humanity, then at least it was not a total loss. But if we quit now and not do anything and not make the best out of this opportunity, in that case, we would have failed the victims twice. Number one, that we lost them. Number two, that we did not make something helpful for humanity, even if it did not help in Gaza now, at least to help humanity in the future in other places, because there are many places in the world that are vulnerable, at risk of genocide. There is a lot of injustice in the world. And like after World War II and the Holocaust, there was no international law before, no universal laws before, no genocide convention before. But because of what happened, the international community came and put all these regulations, and they were helpful, but they were not enough. Now is the time to improve on them and make sure they are much more effective than how they were made in the beginning. Because in the beginning, the major powers agreed to enact these laws, but they put mechanisms there to cripple them or to make them ineffective when it comes to the entrance of the major powers. It is upon us now, the people of the whole globe, globally, that we rise up, all of us, speak up, be very strong, and demand a change in these mechanisms and make it much more easier, much more clear that there are international mechanisms that can be deployed immediately when there is a grave threat or risk to human life. Thank you.
Thank you, Nidal. And maybe you also have thoughts on the next question, along with Dr. Kifah and others. From Yana Mintov, how can we work collectively in the Mediterranean to stop the flow of weapons to Israel? We would like more contacts and to help build an effective network, especially to prevent the death ships.
Yana, thank you for attending, Yana. And I know that you have some efforts on that in your country. What I think we should have a cooperation between us and coordination to work more about it and to have more awareness about it and to get all of the people who are working inside ports, stuff like that, to be involved to stop what you asked. And I think also I saw another question from your side. Someone sent it to me on the WhatsApp. It's about the practical steps. We will send it later. This is my reply. Yana, she's not panelist. Okay. I hope this is enough as an answer, and maybe we will have more discussions later. We will organize another, Yana, we will organize like a seminar or a meeting to discuss the issue you raised, because it's fundamental and essential, to tell the truth.
Can I add more to this, Kifah?
Yes, of course, Dr. Nidal.
Yeah, Kifah, yeah, thank you for your answer. So, unfortunately, the people in the Middle East, in the region, they have not been, what do they call it? They have not been speaking up enough about what is happening. They have not been pressuring their governments enough to take action. The governments in the region can impose sanctions on Israel, both economic and arms, and they can stop the shipments, and they can at least make it harder for the weapons to go to Israel. In the Genocide Convention itself, and in, I think, 2005, the International Criminal Court, they came up with something called the responsibility to protect, right to protect, and the duty to prevent. Every country in the world has the duty and the responsibility to protect and to prevent genocide whenever there is genocide. So the governments in the region, the Arab countries, and the all the Middle Eastern countries, they are not just failing their duty as Arab countries to support their brothers and sisters in Gaza. They are actually committing a crime. Whenever there is a risk of genocide, every country, every institution, every individual, every leader has an obligation to prevent and to protect against genocide. And if you don't take that obligation, you are committing a crime. You can be charged with complicity. So unfortunately, all the Middle Eastern countries, the whole world, is complicit in this genocide. They are not upholding their duty to prevent and to protect, and we should make sure we hold them accountable. And we also want the people in the region to rise up, to speak up more, pressure their governments. I know it's not easy, but again, whatever repression they can get is still nothing compared to what our people in Gaza are going through. So each one of us, whether you are in the United States or Europe or the Middle East, you should be ready to take some risk to protect the children, to protect your colleagues, to protect the hospitals. It is a duty upon all of us, even us as individuals. If we don't do all what we can to stop this genocide, we might be held responsible at one time with the crime of complicity in genocide, because by now it's very obvious it's genocide. We called it a genocide from the beginning, but by now you have the ICC, you have the ICJ, you have Amnesty International, all these institutions saying that this is genocide. It's not an accusation. Amnesty International did not accuse Israel of a genocide. They have enough evidence to determine, they did determine that what is happening is a genocide. So there is no excuse for anyone to act to protect the genocide in every way they can. All the countries in the world, especially in the Middle East, the people, the countries, the governments, the institutions, the hospitals, all are complicit in this genocide, and all can be held accountable at one point, not just morally, but also legally. Thank you.
Thank you, Dr. Nidal. But Yana is from the people who are committed to support us. She's from PIFA, so I know her. I know she's working on this issue practically, but we need to do something maybe focused in this issue, Yana. I promise that we will try to do it in the future. يعني near future, we will say. Annie, is there any questions, other questions?
Yeah, let me gather up the last 2 or 3 and then we'll try and slowly wind down. Deep appreciation for the amount of people that have really held on to our 2-hour instead of 1-hour press conference. Okay, so there's a question on using medical data for the ICJ, for international court cases. Then there's another question on if individual hospitals are silent and this might be for you, Dr. Nidal, is there anything around them being in legal jeopardy for being complicit? And that's US hospitals. So maybe Dr. Kifah, if you want to answer around the data for court cases and if you've done any work around that, and then Nidal on this complicity of US hospitals, and then we'll close.
The question was for the ICG, especially,
Just
or
any
courts?
medical data for any international court cases. Right now, it just says international court cases.
They are asking. This is something that we want to work on it, but right now the only cases that we have is the main cases against Israel, and the data is taken by OCHA. It's for the United Nations and the Ministry of Health. But we are having all of the data, and we have coordination with the Ministry of Health, Palestinian Ministry of Health. So we are ready to go with that. If someone like this is issues that we wanted to go with the practical steps to have like some courts to uphold the Israelis inside European or United States, whatever. We have some legal committee, they are thinking of it, but right now what I mentioned is only through our friends, South Africa, also in yeah. I am meaning the court against Israeli specifically. The court inside Israel, you mean? The question I didn't. Thanks for your time, sir. No, someone said about the Israeli courts or against Israeli. Which courts you mean? The one who asked which courts? Yeah, we had all of the South African courts, all of the information and the data. It is provided for them. Yes. The second question is for you, Dr. Nidal. It was about the private sector hospitals in the States.
So again, we have enough evidence that there is a genocide now. The ICC already issued arrest warrants for Netanyahu and Gallant, and there might be private or confidential or secret warrants against many other officials. The United States itself is complicit in the genocide. The leaders of the United States, Biden, Blinken, Sullivan, all of them are complicit in this genocide. I think they know it. The only reason they continue to send weapons and they deny the evidence of genocide now, because once they admit it, they know that they themselves will be indicted with this. So they are gonna continue to deny this until the last minute. The institutions, whether medical or not, and all the arm manufacturers in the United States, the universities, all the institutions that have been silencing us because we are trying to demand an end to the genocide. The fact that they're trying to silence us, this means they are complicit and they want to enable the genocide. They have been enabling the genocide. There is a quote from Noor Ariqat's book, Justice for Some. She describes law, whether it's international or domestic, like a sail, a boat sail. She said the sail itself does not move the boat. The boat does not does not move the boat. The boat is moved. You need wind to move the sail or to push the boat, but the sail will determine the direction. So the law, whether international or not, it's like the sail. The law does not work by itself. It needs winds from either side to move. The winds is the governments on one side. They want to silence the truth. They want to deny the genocide. So they are putting all their pressure against the ICC, against the ICJ, against domestic courts to not determine that this is genocide. Then we have the people of the world who have conscience, who know the truth, who know that this is genocide. We have to keep pushing from the other side. Whoever is stronger, if the people united and speak up more, if we are stronger, then we are going to make sure that the law holds those responsible for the genocide accountable. If we don't, then they win. The law by itself does not work. It needs us. It needs us to speak up, to unite everywhere, every day, everywhere we can, organize, move together. Even if we did something today that did not work, we have to try another thing tomorrow. Keep trying and failing, trying and failing. If we start with 5 people, let's make it 10 people next week, 100 people the week after. Start with 1 hospital, let's make it with 5 hospitals next week, next month. We have to keep moving, not just for the sake of Gaza, not just for the sake of Palestine, the sake of our own selves, for our own souls. We have to live in peace in this world, with peace with ourselves. We cannot live in a world that allows a genocide that is live streamed in front of all of us and accept this as our world. We should not allow our children and grandchildren to inherit a world that allows a genocide with nothing done about it. It's either the corrupt politicians, the one who are bought by money and by special interests and by pressure by the AIPAC and the Zionist, lobbies. Either they own the world the way they want, which is a dysfunctional, unjust, apartheid, genocidal world, or we, the people of conscience all over the world, take responsibility and create a better world for all of us. We are not against anyone. We just want a just world for everyone to live in peace, liberty, freedom, justice, equality, and it can happen. It's doable. It's very easy. Making peace, there is enough in the world for everyone to live in peace, to live happy. There is enough for everyone. The only reason there are wars, there are injustices, is because the few who are, hyper wealthy or Zionist or racist in one way or another, or associated with the military-industrial complex, they make money out of the misery of the world. They make money out of wars. They make money out of the absence of and lack of peace. So those very few, which you can even count them on, both hands, are against the whole world. The rest of us are not benefiting from this. But for them, having a war in Ukraine, a war in, a genocide in Palestine, and the war here and the war there, this is the best day of their life. They cannot even keep up with making weapons. Can you imagine that? Like, for them, business is going so well that they cannot even keep up with making more bombs and more weapons to more money out of the suffering of the children. They don't care about the children. They don't care about humanity, but we do care. That's why we, the people in the United States, in Europe, in the West, in the East, we all need to unite. We all share one interest, one universal value, which is our humanity, the protection of our humanity against the very few who are dependent on blood. They thrive on blood, on injustice, on war, on controlling the masses, and we should refuse that. It's not an easy struggle, but we don't have an option. If we don't do it, if we don't try everything we can, we're gonna lose, not just in Palestine. We're gonna lose. If this in Palestine goes like this, unpunished, this means they can do it anywhere else in the world, anytime they want. This becomes the new normal. We should not allow this.
Thank you, Dr.
Thank you.
Nidal. I think there any questions? Are there any, or should we conclude?
I think
Do we
for
have any questions?
interpretation, Dr. Kifah, we should start.
Yeah, we should start. Yeah, okay.
Interruption.
Well, thank you all for attending this press conference. Hope you will all of you try to work on the issues that we raised today. We will submit all of the videos and the testimonies and also the PowerPoint presentation. It will be uploaded in our website as a PIFA, and also we will send it through email, right, Annie? We will send it through even the contacts of us, the 3 organizations. And anyone who asked for the practical issues, please, we ask to send their emails in the chat. So we will later try to work on that. Hope we gave you today like a preview or something to show how is the reality inside of Palestine, how is the reality that the doctors, healthcare workers are facing in Palestine, because it's a genocide, it's a disastrous situation. We need all of you to work to stop this genocide. As a PIFA, Palestine International Friends Alliance, we work to try to strengthen the resilience of the Palestinian people and to stay inside Palestine. This is our main goal. Of course, our vision is to have a free Palestine, liberated Palestine. But right now, we are trying to work on the strengthen the resilience of the Palestinian people. Anyone who wanted any information regarding any other issues also, you are welcome to ask us and we will provide anything you needed. Thanks for Equal Health and Doctors Against Genocide that they gave us today with them to focus this floor, to focus on this issue. Today, it's important. We need you to begin to work on these issues. Thank you all.
A huge thank you to interpretation. It was very powerful and deeply long for all of you. So just, lifting up everyone and lifting up all the people that gave testimonies that obviously couldn't be with us online. And we'll carry their words in our hearts. Take care, everyone.
Take care all. And Dr. Fed also for the call and Guranga for the call of action. Thank you all.
Please try, everyone. Thank you, everyone, for all your effort. Please try all what you can. Please try all what you can. I know it's very hard. We are living through a historical disaster, but with historical disasters comes historical opportunities. We have the highest opportunity in our lifetime to make a difference for good, not just a one-time thing, not just one-time fix. So please, everyone try all what they can, mobilize all what they can. And I really think we do have a good chance to make a difference. And if we do that, then all these sacrifices did not go in vain, and it was not a complete loss. Thank you, everyone. Thank you, Dr. Kifah. Thank you, Equal Health, and thank you, everyone, for organizing this. Take care.